Hi ladies, today we're going to talk about the TA. The TA stands for transverse abdominis. We'll just call it TA for short. It is the deepest ab muscle and is directly attached to your spine. Think of it as a bodyguard for your back. If it is strong and engaging correctly, it will protect your back. If it is weak, it will not provide any support to your back and could lead to injury. During pregnancy and birth, it can weaken, and it is important that we learn how to engage it properly. It is one of the key core muscles. I'm now going to take you through a couple of cues on how to engage your TA. Don't worry if this doesn't make much sense to you straight away. As we tie in the pelvic floor cues in the next video, it will start to make more sense. So let's get started. I'm going to get you to lie down, lying onto your side first and then rolling onto your back. Feel free to grab your pillow or pad and place underneath your tailbone. Perfect. We're going to come into a neutral pelvis. So we want to have a tiny little curve through our lower back. The best way of staying in neutral is to just have one knee bent and one leg extended. In this position, you will naturally fall into that neutral pelvis position, and you don't have to think about whether you're in the right position or not. I'll now get you to place your fingertips in between your hip bones. So I want you to find those two bony prominences, and I want you to sink your fingertips down in between them. I want you to let your stomach completely relax, let it go like jelly. You want to feel like your skin is soft underneath you. From here, I want you to cough. So you're going to cough and you'll feel that muscle lifting underneath your fingertips. Now, can you feel that muscle? Yep, so when you cough, that muscle lifts. It pushes your fingertips up. Let's go again. We're going to cough. That's it. Now, the reason I'm getting you to do this cough test is just so you know what it is that you're feeling for. We're going to start to incorporate the breathing now. So what I want you to do is you're going to inhale for 4, exhale for 6. On count number 6, I want you to squeeze the muscle that's underneath your fingertips. Now, a little cue that I sometimes use with my clients is to imagine you're in a boxing ring and you're about to be punched in the lower abs, right where this muscle is. Now, I don't love using this cue all the time because what it might do is cause you to breath hold or pull your belly in towards your spine. But just as you're learning to engage your TA, it's a really simple cue that will make that muscle switch on properly. So keeping your fingertips there, start off by softening your belly. Just let your fingertips sink down. I want you to inhale for 4, using your diaphragm, and you're breathing out for 6. On number 6, imagine you're about to be punched in the lower belly in that boxing ring. Perfect. Hopefully you can feel that muscle activation underneath your fingertips. Let's do a couple of more. You're going to breathe in for 4. Big breath out for 6. On number 6, we're going to squeeze that muscle, lifting your fingertips up. Now, don't worry if it feels quite weak. That's normal to feel like it's withering away after a second or two. It will get stronger. For now, all we're trying to do is bring awareness to this muscle and just get it engaging. Let's take another deep breath in. Big breath out. On number 6, imagine that punch to the lower belly in the boxing ring, lifting that muscle up. One more, breathe in. Big breath out, let out all that air. On number 6, squeeze. Beautiful. Lifting your fingertips up. Practice that a few more times at home before you move on to your next video, which is all about the pelvic floor. Nice work, ladies.